It's Tuesday morning and you're welcome to Jasiri. Today, we turn our attention to two stories that speak to everyday struggles of Nigerians: the fight for space and the fight for survival. In one situation, residents of a private estate are raising alarm over encroachment, land originally allocated for homes now taken over, leaving families caught between developers, authorities, and uncertainty. It's a story about property rights, governance, and the growing tension between citizens and those meant to protect their interests. And across the nation, resident doctors are once again on strike. They're demanding better pay, working conditions, and resources to save lives in a system already stretched so thin. For patients, the impact is immediate. For the health sector, it's yet another wake-up call. Two very different battles, but both asking the same question: when will systems in Nigeria start working for the people, not against them? Let's get started.
First up on our agenda in Lagos today, tension is brewing between Omole Phase 2 estate, a community originally planned and approved by the Lagos state government as a strictly residential area. But that vision is now under threat. Residents say parts of the estate is now being taken over by unscrupulous businessmen who are flouting established laws and converting residential plots into commercial spaces, disrupting the peace and safety of the estate that the estate was built to provide. Even more troubling are allegations that some government officials may be backing these illegal conversions, issuing approvals that directly violate the very guidelines that created the estate in the first place. Today joining us is Mr. Moshood Shehu, the chairman of Omole Phase 2 Estate Community Development Association. We also have the first vice chairman of the CDA, Mr. Anthony Akpojaroh. Gentlemen, welcome to Jasiri. I wanted to pronounce your name to make sure I got it.
Mr. Shehu, let's start with you, and that's because you're the chairman of the Omole Phase 2 Estate CDA. In terms of your experience, and I want to lay this out because Nigerians, we can be very difficult people. So in terms of your experience in managing a community development association, take us through that. How has it been? What lessons have you learned about managing people?
Actually, managing a community development association, for me, has been very educating. And I would say it's given me broad spectrum experience. Because you are not only managing men and materials and resources.
Yeah.
You are looking after the security, welfare, and well-being of your residents. And you have to be like a jack of all trades. You have to know a little of almost everything. Okay, let me give an example. At your general meeting, you have to, even though you are not an accountant, you have to defend accounts. And being grilled by chartered accountants, or, oh, Mr. Chairman, this item is this and that. And then again, you also have to have a very good relationship with your publics, with government. I mean, anything can happen. Security, you call the neighborhood watch, call the DSS, you call the Rapid Response Squad. There's traffic, you call the LASMA. There's building control, you call LAPCA, you call all sorts. So you have to have the contacts of all the government agencies, and you have to be in good relationship with them. So these are not things you can get to learn in school. So it's been a very good learning experience for me. And stressful, but I would say at the end of the day, very rewarding.
Mr. Akpojaroh, the estate before now was once recognized as and awarded by the Lagos state government. Tell us how this award came to be and how it was achieved.
Okay, thank you for that question. So it was awarded as one of the best estates in Lagos State. And that would be in correct me, Mr. Chairman? 2011. But even at that, recently, we were also designated as, and this was sometime this year, one of the 5 livable estates in the state.
This is something to fight for.
Yes, it's on record.
Is something to fight for.
Unbelievable. What would the
So some of the variables you should use actually to measure that would be, first and foremost, is it family friendly? 2, can you bring up children there? 3, what provisions are made for the elderly? What about the young ones? And then, generally speaking, what is, in quotes, the level of serenity if it is regarded as a residential estate? So as a human being, when you get back home, you're asking yourself, am I comfortable? What are the infrastructural provisions, that make the place even livable? So I'll give you some instances. 1, we have street lights in our estates. Most of those we provided. We also have CCTV coverage, and we have security apparatus at different levels for the security of our residents. And so it's a place you really want to go back to after the hustling and bustling of the day.
All right, Mr. Shehu, so let's look at the challenges facing the estates. What are the main challenges, and how can you prioritize, or on a scale of 1 to 5, what are the main challenges that the estate is facing?
There are several challenges, but the main challenges facing our estates, I would say, is actually not peculiar to our estates. And that is the challenge of, the main one actually, the challenge of development control. You see, what has made you to be successful is the same thing that is going to put you into trouble. Because our estate, I would say, is probably the best government estate in Lagos State. And if you say Lagos State, you may also be saying, probably, I don't want to talk in superlatives, but probably the whole of the country. So, because you see a government estate where all the streets are covered by CCTV, where all the streets, I'm talking of about 26 streets, have street lights at night, where there is foot patrol, there is bike patrol, there is van patrol, where you have not had any major security breach in the last 10 years, where you have a playground for children, where you have a senior citizen relaxation center. I mean, how many government estates will boast of this? So this has now made us to be the cynosure of developers' eyes. So they now come in, especially the outer Shomide Odujiri avenue of our estate. You now have developers wanting to have commercial property. When the government has designated the estate as strictly residential, that's why it's called Omole Phase 2 residential.
Estate, yes.
And of course, provisions were made for where you have commercial, we have schools, we have other commercial outlets. But you have situation where developers are now putting pressure on the system to convert plots originally designated for residents.
Yes,
to commercial. And I'm sorry to say, people may say, maybe they are just selling things and all that. But that's the cancer that really destroys estates. I don't want to mention names, but there's a very popular one. That is Festac Estate.
Can you just mention?
I won't mention others. But we all know. We've seen them like before and then the after scenario. We don't want our estate to go to rot. We don't want it to go through that unfortunate trajectory. We want our estate to remain a residential estate.
But this
For markets, we have the Ikeja City Mall, we have the one in the Sherry, we are comfortable the way we are.
But this begs a question, because it is it's a state government designated residential area. So who is giving these developers, I'll use the word, the impetus, the audacity to encroach?
Okay, let me say, you see, there are two ways they do it. There are some that will convert, they will get approval for residential. After they have built, they will now convert to commercial. So our CDA has started the campaign, build and use as approved. But you know, we don't have the power of enforcement. So we try to talk to them, but if they don't budge, then we escalate to the Lagos State Ministry of Physical Planning to come and help us.
That was where I was going, because...
Please, let me come back to the second scenario. Now there is a plan. We learned there's a plan by government to actually redesignate the estate as mixed use.
Mixed use, commercial and residential.
Yes, commercial and residential. And this is actually the insidious one. This is the most serious one. Because in fact, now we have a particular resident in our estate who has an eatery beside his house. And there is a rumored plan that an hotel is coming. So you have a family man sandwiched between two
businesses.
You know, I was wondering, because sometimes when these approvals are given long before and everybody has complied, we just have a way of stepping away from the original master plan. And then we'll now start retracing our steps to see if we can correct what we should not have even allowed in the first place. Now that you have this grievance, I just want to know what steps the association has taken to engage the government, to draw their attention to this, the challenges they face. Maybe Mr. Akpojaroh can answer that.
Well, okay. So one of the steps that have been taken is this has been highlighted to the Ministry of Fiscal Planning. A meeting was held where the immediate past chairman to my chairman and himself visited the ministry, and a serious complaint was made. I think one of the directors was in attendance, and he actually listened and understood where we were coming from. My understanding, the outcome of that meeting was that he was going to relay this to the commissioner and get back to us. We are still waiting for that response.
When was this meeting?
My chairman will be able to
I
say.
think that was last year.
Last year?
Yes. Let me also say that we've actually escalated it to the governor. We've written many SOS to the governor that the situation in our estate should be looked into. The estate is a poster child for how an estate should be. And Lagos State government should actually be proud of what they have done in conjunction with residents in that estate. So you don't want it to go the other route. So we've escalated it to the governor. We've written to the Ministry of Physical Planning. But I guess the pressure from developers is also there. And maybe they are having the ears of government, we don't know. But when you see hotels, when you see eateries, and when you see shopping malls coming up in a strictly residential estate, then we are really worried.
I just want to ask, because I'm not like a physical planner, but I've been privileged sometimes when you go abroad or you go to some very confined spaces, there in an estate, there usually is a commercial hub in an estate. I don't know if I'm wrong. I just came out of Bonny, and I know that in that estate, it's a very secluded estate, it's residential. Is there any provision in the master plan for like a hub where there is commercial activities are concentrated? Like if you go abroad, almost every county there will be a shopping mall in that services the people of the area. Is there a provision like that?
In the original master plan of the estate, there was, but now we don't have that. But over time, we have shops, we have groceries around the estate.
Small supermarkets.
Yes,
Corner shops are there.
Yes.
Yeah.
But you see, our complaint is that if the government want to redesignate, there are ways to it. Under the regional and planning law of the state, you consult, you call the CDA, it's a provision of the law. It's not at your convenience.
Yes.
You have a prerogative to do what you want to do, but you have to consult, and that has not been done.
So as we wrap up now, what are the next steps for the association, given that you have now written SOS to the governor? You had a meeting last year, continue to await the feedback from that meeting, but it appears that people are moving ahead. And before you know it, all it takes is 1 or 2 people. And then the whole idea of Omole Phase 2 estate becomes a moot point. So what are the next steps for the association?
The next step is we will continue to appeal to the government to come to our aid. Because we are fearful of what has happened in other estates, and we don't want it to happen in our estate. And we'll continue the advocacy, we'll continue the engagement. We are not confrontational. We just want them to see it in our own light and follow the law. The law states you must consult stakeholder engagement. That has not happened.
Are you going to take legal action eventually?
That's probably something the Board of Trustees will consider.
And let's not forget how legal action works out. You have a court order. Things happen. Gentlemen, thank you so much. We'll continue to follow up with this. Unfortunately, the story coming out of Omole Phase 2 estate is one that is now being replicated around several areas of Lagos. And it's something that we as Lagosians should be concerned about, because there have to be areas that are just for us, for families, for people to grow, for serenity. I love that word. How many of you can talk about a serene environment? We'll keep watching to see how this develops. Now, coming up on Jasiri, hospitals are quiet, but not because patients are healed. Nigeria's resident doctors are on strike again, and lives are hanging in the balance. The government says it released 11.9 billion naira to end the doctors' strike, but the doctors say it's not that simple. When we come back, we'll unpack what really is at stake. Stay with us. Now, across Nigeria, hospitals are once again at the brink of collapse. Wards are empty, surgeries postponed, and patients turned away. The nation's resident doctors, the backbone of Nigeria's public health system, have downed tools, paralyzing medical services across the country. The National Association of Resident Doctors, NARD, says this strike is about more than money. It's about broken promises, unpaid arrears, and a healthcare system that continues to push its most critical workers to the edge. The federal government, in its response, announced the release of 11.9 billion naira to cover outstanding allowances and pledged mass recruitment to fill manpower gaps. But the doctors say the numbers don't add up, insisting the funds neither address their full entitlements nor fix the systematic rot that keeps them protesting year after year.
Now, according to reports, the ongoing strike has already grounded operations in federal and teaching hospitals, leaving patients in dire need stranded. And while negotiations drag on, lives quite literally hang in the balance. This latest clash between the doctors and the government raises deeper questions. Why do these crises keep recurring? What does it say about our priorities when these repeats feel unheard, undervalued, and overworked? And most importantly, is there a real plan to restore trust and stability in Nigeria's healthcare sector? Joining us this morning on Jasiri is Dr. Victor Oloregbulem, General Secretary of the Association of Resident Doctors, Federal Medical Center, Ibutemeta. Victor, you're welcome to the show.
Thank you very much.
Good morning. Thank you for joining us. Why am I back here asking questions again? All right, but let's get the conversation started, because it's a very needed one, and it's unfortunate that we're back to strikes again. But the National Association of Resident Doctors are where they are in this situation. Can you walk us through NARD's minimum demands? What are the non-negotiables for the association in response to what are the core demands and the red lines of this situation?
Well, our minimum demands are the 19 demands we've listed so far. And I'll start by pointing out I'm the General Secretary. My president would love to be here, but fortunately, I'm here representing him because of some other events and schedules that he needs to meet up with. So I'm representing my president, and I'm the General Secretary. So our demands are the 19 demands, and they are pertinent because most of these demands are demands that are not new. They've been there for over years. Some are failed promises, some are demands that were never met, and some were just MOUs that were signed and was not kept. So the resident doctors on our own end has kept to our own bargain by either suspending a strike, calling off a strike, and then going back to work and expecting the government to do its own part. By the end of the day, we're left with just promises and we will, and we will. Until today, we still have some we will.
We will.
Wow. Exactly. It seems like NARD has decided to, the government has entered one chance in street balance with NARD. So the government says they've released 11.9 billion. You guys say it's not enough. Why is it not enough in your view, like in the association's view? And how do your figures differ from that of the government?
Well, I'll thank you for that question. 11.9 billion, yeah, is a large sum of money. And to make the populace feel like, okay, doctors are just inconsiderate, they have to put up such figures. Now, that figure don't reflect what we, for resident doctors alone, that figure reflects for the entire Ministry of Health. We have the doctors, resident doctors, we have consultants, we have the non-clinical staffs, we have the nurses. That figure covers everybody. It was like the arrears, particularly this particular one they have been disposing over the last 72 hours, is for everybody.
So
we work in the hospital.
You're asking for is your own?
Yeah, that's just like one out of the 19 demands, and that one covers everybody. So you take just one, attend to that one, and what of the 18 others that is peculiar to us, specifically just us? So we are now fighting for everybody, which we don't have a problem with. But however, take up the other 18 and sort them out too.
You know, I'm looking, you know, when it comes to this, when you guys reach this impasse and the government is on this side and association is on this side,
and the people are
in the middle, it becomes a really tough question, because decision, because it's not like what they're asking is out of point, or the government too, I'm sure they have reasons why they are doing what they are doing. I just want to know if there's any clarity between the government on how they plan to implement the demands. Like, did they give you guys timelines, disbursement process, verification? Are there anything they've put on ground that shows a forward movement in the accomplishing of some of these 19 demands? At least they'll say, we've brought out some money, which is a far cry for what we hear on some other times when associations strike. We might hear promises, but this time around they quickly put something out, which is very unusual. So are there timelines? Are there verifications? What's the disbursement process? Is there anything, no clarity from the government?
For now, I will just speak on what I'm privy to, right? So for the first, around August, NME wanted to go on a strike, which was averted by We Will, and then a 2-month arrears was paid, right? Now, August came to an end. The We Will never came to pass. October came to an end. The We Will never came to pass. This is November beginning. So timelines with the federal government seems not to be heard or something to believe to. So therefore, we don't really want to see timelines this time around. We want practical, secularized documents stating demands are met. I think that should be the next line of action, because with timelines, we've exhausted timelines. We gave 21 days, that's 42 before August ending. August again came September, and then we gave another 30 days, no communication till day 25. Before they now came up with, okay, what do we do? They now come out with, okay, let's release money. Money is, most of those demands, money is part of it, but not the major demands. So then the one you've released is for everybody. It's not like you're attending to just what is peculiar to the resident doctors. So far, so good. 1/19 is nothing compared to
not a win.
Dr. Victor, the frequency at which these strikes, threats of strikes for a very sensitive sector the frequency at which it happens is very worrisome. And it's especially worrisome because of the service you render towards the populace and the type of service you render. And when this happens, you have skeletal services, you have very few staff providing a primordial aspect of care. So tell us, what's the risk that this breakdown can happen in terms of medical outcomes for patients that are so primordial to the care that you give? What are the risks?
Well, the risk, I can't assess the risk because now we are not at work. The consultants are the people at work and other health workers. So the consultants are working. So the risk to the patient, I can't assess the risk. But we ourselves have been suffering and enduring the stretch of the burnout. So therefore, we can't really keep sacrificing ourselves on this table. I think at this time, it's time for doctors, patients, everybody to come out and shout for FG. Please attend to these demands because they are legitimate demands, and I think they should be sorted out.
So we have the timeline because we only did 5 years because we could have gone 7, we could have gone 10. But if you look at that timeline, I hope we get it back on straight. And you can see the fact that certain issues are just repetitively coming up when it comes to the engagement of the National Association of Resident Doctors with the Nigerian government. And you see there was one in June 2020, it was about PPE shortages. That was during the time of COVID and the allowances. And we saw a serious issue. Strike suspended after federal government promised better welfare. As Victor puts it, we will. Then you had August 2021, unpaid salaries, poor insurance for deceased doctors, suspended after court order and partial payments made. If you keep going, then you now see 2023 as well, salary review. By this time, brain drain is now starting to really deeply bite. Very deeply bite into the sector on paid arrears. Again, strike called off after the Senate intervened. 2023 yet again, failure to meet the agreements made in May. Delayed arrears. MOU signed, partial implementation was ongoing of that. Up to now, that you have 2025 unpaid salaries. It was a 5-day warning strike that this particular strike was coming. And the government did a few we will, and made some promises. Now we are at a strike that started on November 1st. We're 3 days into it. 19 unmet demands. Government is paid about 11 point something billion. The doctors say 38 billion is owed to health workers, and we don't know how long this strike is going to last. I lay all that down because at the end of it, as Lolo said, it's the Nigerian people in the middle.
Yes.
We also saw a post, I believe, is from the president of the National Association of Resident Doctors, who urged Nigerians to support them. And I know Nigerians have been going to public hospitals and complaining. They're complaining about the wait time. They're complaining about the lack of skilled doctors to treat them. And so these are issues. But when Kathleen asked you about how it impacted the patients, you said you were unable to assess the impact. So let's flip that. All of these situations leading up to now, how has it impacted resident doctors? We've been hearing a lot of stories recently about doctors working 24-hour shifts.
Yeah.
Doctors, let me not put words in your mouth. Let's hear it from somebody who's a resident doctor, who's representing them. What has been the impact of the brain drain, a lack of salary payment, a lack of increase in salary, a lack of insurance? What is the impact for the doctors?
Well, it's beyond bound. You sounded like 24-hour shift was a long one. Well, that should be the minimum any doctor in Nigeria go through right now.
Wow. You're kidding me.
We have doctors, particularly in my center, we have a doctor who is on call every day and barely just go home when he suspects the terrain may be a little bit calm and just
Suspects?
Yeah. Then go
7 days a week. And then just keeps that 7 going.
For 28 days in the month. And then we have some who are the only residents in their unit, but based on the recent cries and all of that, the management and the HODs are now like, okay, make a roster, put yourself on alternate day. But me and you already know that's blank days where his name is not reflecting. It's just for social media. He's still the one going to do the covering, either physically, virtually, but he's still the one going to be reporting to the seniors, the consultants, why either he sneaks home or come back and all of those things. So it's quite stressful and the burnout is real. Yes, some Nigerian doctors left the system not because they really believe abroad is or other places are greener pasture, but it's safer and saner. It's safer and saner. There is no reason why you should suffer so much and then all for just a little. At my own level right now, if I left where my colleagues live, I probably would be better than I am right now. But some of us decided to stay for different reasons, and many of us regret staying, actually.
Because do you regret staying?
Personally, I do. Wow. Because it's actually, it doesn't reflect it will get better. I don't think it will.
How long ago did your colleagues leave? How long has that? When did they leave that?
My colleagues, okay, I will talk about, I graduated in 2017. Most of my colleagues left in 2019, 2020. Currently, if some of them decide to come to the country, I decide not to see them because you have nothing to show for the work you've stayed. My colleague came from the US the other day. He was lodging in a hotel I have never knew existed in Lagos. And I can't even imagine paying that kind of bill for an overnight because I can't avoid it.
So if you had a chance to leave, you would
I may consider it. I should consider it.
Dr. Victor, you know, I kept listening, and I know how dire the situation. Even doctors are collapsing under the weight of work because we've talked about it here. The ratio of doctor to patient is not natural in Nigeria any longer. I'm just wondering that, let's even look at the demands like on working infrastructures, medical supply and support services. Those are things that are very, very important, like diagnostics, medicines, labs, all these that resident doctors need for them to be able to do their utmost for people. Let's even leave your professional qualification. These services are the things that, you know, is part of the bedrock of your work. As the government even, you know, dug down into that, provision of infrastructure, you know, medicines, all those kinds of things.
Well, they are doing their part in their own little way. But most of the federal or the government parastatals that are functioning or similarly functioning, they are not going into private-public partnership. So that, in a way, is trying to sort out some of the infrastructural issues, but then it comes with its own downside. You know, private partnership, the patient then to bear the brunt of it because everything, you have to put in the realistic figures of getting access to those health facilities. So that, in a way, tend to sort out the infrastructure. For some of the institutions that have the privilege of having a private institution or a private person who has enough money to try and risk the PPP.
I know that, you know, strikes in the health sector, I mean, I can feel your, is it despondency?
So and it's like it's become water off a duck's back. It feels like you don't feel it anymore. Not that you don't feel the situation, but like you are resigned.
Yes.
You're resigned to the situation.
You're resigned to the situation.
Well, like I will say, some persons, okay, just let me give you just a scenario. You've been on call for like 5 straight days, and then you have 2 days to just weekends. And then on that same weekend, let's say you were thinking nothing will happen, and then an emergency shows up, and then you get busy again. And then at the sound of, we're likely going to go on a strike, what will you do? You feel like, oh, what a relief. I need to go home and rest. And then you hear doctors tell you, the executive, if you call up that strike, we'll kill you, we'll fight you. You must not call up that strike. And government must not answer us, and all those kind of things. You see doctors wishing that the government don't answer because you need that rest.
Wow.
Because the work schedule currently, I was talking to a friend and I told him, I was talking to a house officer actually, a doctor, a colleague. I told her that, see, the work schedule is in a situation whereby you can't comfortably tell your friend that you've known for ages that I'll be at your wedding. It's impossible. You can't outline your life like that because you can't be so sure you'll be off duty on his wedding day. And if you are on duty, you don't have that backing. They say, my colleague will cover for me. You don't have a colleague. You are alone in that unit.
You are the colleague.
You are the one-on-one. So you don't have someone to say, guy, let me do 2 days now, so you do the other 2 days. I'm going for my colleagues' my best friend's wedding. It's quite, and it's getting worse because of the scenario, more people are becoming more desperate to leave.
Yeah.
Some people that their mind hasn't been made up to leave, they want to leave. And I understand that they will, I think, because of the conversion rate and all of that, so it's limiting some little way. But I know once opportunity comes, they will all
take it immediately.
I'm thinking about the public backlash because it's, the narrative now. It's easy to feel like you are abandoning patients and you're abandoning SHIP, even if there's an oath you guys swear that, okay, so you tend, the work is not about you anymore, but the public doesn't see it like that. Once you've reached the point where NARD has reached and say, if you call off this strike, we're going to fight you, they feel as if they need that time to rest. But the public outcry is different. You might be accused of abandoning patients and all of. How do you guys deal with that narrative? And what response do you have to
for that?
critics?
I will just have to say this. When you board a plane and then the pilot over the radio says, I've been flying for the past 48 hours and we're about to take in another 10-hour flight.
Please, I left something in the terminal.
Will you take that
we
flight?
No.
So, but unfortunately, when a doctor tells a patient, I've been awake for the last 48 hours, the patient still wants the doctor to go ahead. And then if there is any issue, you still hear them say, that doctor is not good, this and that. But then a tired doctor is a dangerous doctor.
Imagine a tired surgeon. He'll probably botch the surgery.
It's a keg of powder. Like, really and truly, I was reading statistics last week about how the lifespan of the average Nigerian is 56 years. That includes doctors. You do not have pre-care, you do not have palliative care after. You can't give what you do not have. Doctors cannot treat when they are not being treated. And so this is really, really dangerous. And I'm just happy Dr. Victor is here. Everybody can hear he's a resigned man.
Yes.
And everybody has to play a role in ensuring that the most important sector of our nation, healthcare, is cared for. It almost seems like nobody cares about these people who care for us.
The people.
And interestingly, I mean, I don't even know whether, Dr. Victor, you have any reforms, some recommendations as to what exactly should we be doing across segments? What should the media be doing? What should the people be doing? The government be doing to ensure that we really prioritize and deter constant strikes from happening?
Well, my response would be the 19 demands have their clear-cut demands. They are not bogus. Like the number one about work schedule.
Hours.
So many countries have their own work schedules. I was going through some, even as an African country like Kenya, they have an official work limit, 40 hours per week. But in Nigeria, we don't have that. You work till whenever the works end. So it's kind of, let's start with at least meeting these demands, regularized work schedule, regularize a lot of other things. Part of the demands are more of welfare and work conditioning and all of those. So if you sort out that, let's say you say, okay, Nigerian doctors, you must not work above 40 hours per week, that will clearly make, in fact, some of our colleagues who are currently in the public sector that refuse to do residency, they will likely come and join the residency pathway. Because when you say 40 hours per week, let's start this residency.
That's that's corporate working hours.
So that would be quite
there was a question earlier, Lolo had asked about timelines, disbursement, oversight, structural reforms, and all of that. But you also said earlier, you've heard too much of we will, and they never. And we're back here again, another strike. How far is NARD willing to take this? How long? Because when you look at your timelines, you guys have done strike. And I want to ask, because we asked ASU this, we've asked NLC this, is strike the only tool, I won't say weapon, is strike the only tool the association has? Because it seems strike is the only bargaining chip that our government recognizes from many critical associations. Do you think does NARD see strike as the only tool to get government to the table?
No. Strike is not the only tool. diplomacy, dialogue, or however, they failed over time. Like the accoutrement allowance was back to 2023, and it's still being owed in 2025. Dialogue has been ongoing. Dialogue has been ongoing. We will cover this in before the end of August. That was the last dialogue. August 31st was the federal government deadline, and that was a deadline fixed by federal government himself. And then they failed at their own deadline. So at that stage, will dialogue still help?
You know, one thing, when strikes occur, one of the things I think about is, why are we so quick to accept that we will? Because most of the time, these conversations that we're having are never different from time to time. We're just discussing it at different times. In 2017, it was the same discussion.
Yeah.
2020, 2022, 2023, we are still discussing this. It's a different thing that we are ready to stay and get these things done. It might be a long haul, but why is it that they are so sick? Is it that they have the patient in mind? Because maybe they are what's that autocrat? What's that your law? Hippocratic law calls to you that makes you soft pedal. That the things that are needed, that are crucial for your survival, you guys are willing to just take their promises so that patients don't suffer. Is that the real reason? Or are there other reasons? Because some will say that, some association member go behind to talk to the government and take some cutbacks and make every other person look bad. What is really the issue? Because I want to know if you are standing for the long haul, or this is just another, will appeal to our church mind, as they will say in public parlance. If they appeal to your church mind, rub your head small, just throw a little more into the mix, you guys will subsped up.
Well, over the time, at least from my own experience, we've always soft-pedaled most time just because, okay, our patients are dying, and then, sometimes you can't say who will be the next patient. It could be your own relative, it could be anybody you know, and then you'll be like, okay, what have the federal government done so far? And you get a lot of we, just like seculars are beginning to come out again of we will seculars. They have started coming out since over yesterday. And so you say, okay, what do you think we should do? So let's call up the strike, let's believe in them, let's give them that level of trust. And then we go back to work, and then 1, 2, 3, and then you start waiting for the implementation. And that's where you start hearing grammatical structures, how English can be quoted, and then MOUs.
But when you guys say that, because you subspedal for them sometimes, but this dance, the rhythm has never changed. So if it's about trust we're talking about, this trust has already been eroded over and over again. Yeah. So what is the government doing differently that is making you trust them if you have to? What would they have to do to earn that trust really?
Well, for this particular strike, we are not bargaining or keeping our own side of the bargain based on trust. We're asking for seculars, we're asking for implementation, we're asking for documentation. Like prior to, we can just have an MOU signed, and then we're like, okay, like an MOU was signed in July with NMA, and up to now, no implementation. So for this particular strike, we are willing to go all out and wait it out. Implement these demands. Let's see seculars. Let's see evidence that it has been implemented as signed. And then let's see not just MOUs this time around. Then we'll now say, okay, we cannot come back to work.
I want to give some data as we wrap this up. As you were speaking, I had to go and look for it. So according to the National Association of Resident Doctors, nearly 19,000 doctors have left Nigeria in the past 2 decades, in the past 20 years, with a record 3,974 departing in 2024. And so many of this is tied to, of course, the poor welfare, low pay, and deteriorating working conditions. Stay with me, please, because I'm going somewhere. Now, according to it's difficult, how many resident doctors are left? The number is anywhere between 11,000 to 11,899. What does the association say in terms of how many doctors are left?
We should be less than between 6,000 to 8,000.
You said what?
Between 6,000 to 8,000.
Okay.
That's the ratio of
Okay,
patient to
so wait, I'm getting to the ratio. So while there's no single number, WHO says that there should be a minimum of 17 doctors per 10,000 people. That's 1 doctor per every 588 people. And I went to do the math, but my math was based on 11,000. So at 11,000, it had 1 doctor to 16,000 plus people. So if you do 6,000, that's what I can't. I'm not a calculator, but just imagine the ramifications, the consequences, the built-up.
Absolutely, Tolu. And the fact of the matter is that I don't even think that Nigeria has 200 million people. We have more than 200.
I just wanted to base that.
So census has not even been properly done in this country to update 2025 population figures.
And I want to go back to something you said when you were talking about the lifespan of Nigerians. Recently has gone down to 54 years, 56. Yes. And the point I want to make is that's a general average. If we go down to certain segments, I can imagine what the lifespan of a resident doctor would be, because with the working conditions, it's not going to be the national average. The lifespan of resident doctors is likely going to be below the national average. The lifespan of teachers is likely going to be below the national average.
You're too young for this. It's time to leave the country. I mean, I'm not supposed to be advocating for this, but what I'm going to advocate for is that the federal government, please, see my hands, please. It's time to take this seriously. These doctors cannot, in any way, shape, or form, continue to die trying to save people.
You know, I did see a meme this morning. I didn't even know
we are setting up on this
escalate
platform.
when a doctor his phone keeps ringing and ringing and ringing, and he's in different scenarios, and a friend will call him that, do you know that our friend that's studying computer engineering, the guy just bought a Benz. You know that they're not slow mode the video, like, you know, that come back kind of soundtrack, like, what a life, what am I doing here? It's high time we take this critical sector seriously.
Absolutely.
Because it's not just about the doctors. Think about the people, the populace that need medical care, that they are willing to give, but they cannot keep giving medical care at the expense of their own lives.
Absolutely.
Is a doctor going to collapse on the table?
So if the doctor collapses, where's the doctor to treat the doctor?
To treat the doctor.
Victor, we have to go. This is a conversation we will keep an eye on, and we hope that the president of the National Association of Resident Doctors will honor our invitation, and keep this conversation going. Thank you so much. Unfortunately, there's not enough time. I have goosebumps because we'll continue. This is Jasiri. See you tomorrow.